Welcome to State of Affairs. I'm Steve Adubato. We are, in fact, coming to you from the Agnes Veris NJTV studio of Newark, New Jersey. It's my honor and pleasure to once again welcome State Senator Joseph Vitale, who is the chair of the Senate Health, Human Services, and Senior Citizens Committee, vice chair of the Senate Labor Committee. Good to see you, Senator.
Good to be here. Thank you.
Thank you. Let's jump right into a variety of issues. The first one, Catholic Church, no secret, crisis going on for decades now involving priests who have, in fact, assaulted, abused disproportionately young boys. Pennsylvania grand jury investigation produced what? And then we'll talk about New Jersey.
Well, the Pennsylvania grand jury produced 900 pages of report, 1,000 victims and counting. 300 priests were named in that abuse over decades. And that's just really the tip of the iceberg for the rest of the country. In New Jersey, we have the same problem. You know, sadly, our Catholic Church in New Jersey recently stated that New Jersey is no Pennsylvania. I don't even know what that means. The abuse,
that was the official statement of
that
the
was
church?
One of the official statements, yes, initially. You can look at us, but we're no Pennsylvania. That's just wrong. We know that. I've worked with victims and survivors for 20 years in the legislature since I've been in office, and I have met with dozens of them. And the stories are just awful. How the church hasn't responded appropriately. Now, the Attorney General has launched an investigation. I've asked them to do that. They're going to impanel a grand jury eventually.
Attorney General
Graywall here in New Jersey.
Right.
Going to impanel a grand jury eventually after the task force does their work. They're going to subpoena all the records and find out where the truth is.
What's the goal?
Pardon me?
What's the goal?
The goal is to establish that there has been over decades, not just a pattern, but institutional abuse and a cover-up by certain bishops over time. And that abuse has not stopped. We still hear about cases today. I think the church has done a better job trying to weed out bad actors. But when you rape a child, there is no excuse. There's no justification for that, of course. And now, many years later, when they're adults, they have no remedy other than to sue their abuser, their rapist, and the institution that may have enabled that abuse in court. And that's what we're fighting for.
We're talking with State Senator Joseph Vitale. This is a national issue, not just a New Jersey or New York issue. Statute of limitations as it relates to these cases. Your legislation says what about that?
Well, I've worked with the survivors, and they said we need a compromise. 2 years is too short.
So right now it's 2 years after the incident, or?
It's 2 years after the discovery. So if we turn 18, you have 2 years to bring a claim, meaning that the statute of limitations says that the discovery rule is this. Once you connect that your injury, your psychological, emotional damage has been done to you with the abuse, you have only 2 years to bring a claim against your abuser or the institution.
What's wrong with that, Senator?
Well, it's too short because you have victims and survivors have not ever reconciled this abuse. They live with it every day. They're not told their wife, their husband, their mother, their father, their sister, their brother, their kids that this happened, and now you expect them to tell their family what happened to them and relive that abuse again. It's like asking a rapist to relive the rape and all those awful memories that they've carried with them all these years. And so 2 years is too short. The survivors would like 7 or 8 years or age 55. It's not complicated, but the legislature has been much more accepting of making change now.
The mood is right to do this?
It's always been right, but now...
It's always been right, but it hasn't been done.
There have been
other attorneys general who have not done it. There have been other government officials at the highest levels in the state of New Jersey who have either refused or couldn't or whatever you want to say. No, this is not a secret. They have known it, and they have chosen not to pursue this from a legal, governmental, public policy, legislation, none of it.
I've asked them for...
And is that an overstatement?
No, it's not an overstatement. I've asked them for... I've been in office for 20 years, and I've met with every attorney general. And they've all said, well, we have this memorandum of understanding with the church, and they're doing a better job of cleaning up their act. And
how about naming the people? How about naming the people who raped little boys? No,
girls.
That wasn't part of the agreement, was it?
No, only going forward. Only after that agreement.
You mean if something happened after that?
Before
what about
that.
So,
if something happened before that, we don't need to hear about it. We need to know about it. It's after the fact. After 2002, they enter into an agreement with the church, and they say that you shall tell every story going forward, but not retrospectively.
Steve Adubato, this is State of Affairs, talking with Senator Joseph Vitale, the issue of sexual abuse, the assault of young boys by priests in the Catholic Church, and the way the church has dealt with it. Wondering, where is the church on this? Our executive producer, Jackie Heyer, our entire team, we reached out to the church more officially, more specifically, my diocese, Archdiocese of Newark. We are waiting for Cardinal Tobin to agree to, I don't know, Jackie, tell me how many times we've asked, We're waiting, look forward to that interview. It's been many, many times, and I promise you he will be here, hopefully, and respond to those questions. Is that part of the story? That they're not very public about how they talk about this?
No, they don't. There was a prayer service just last week at the Basilica, and they asked for prayers for the survivors, and they talk about how sorry they are that this happened. And I know they're being very genuine about that.
Yeah.
But that doesn't mean that they've really exposed what happened.
And the Pope?
Well, I'm disappointed in the Pope that he hasn't gone far enough. He has to say that all the bishops that knew, any archbishop, any church leader who knew about this abuse has to go.
One more thing on this. We'll have the Attorney General in the state of New Jersey, Attorney General Grewal, who will be joining us. There is, in fact, Jackie, if we can find that hotline and put it up, there is Attorney General's office. They have a hotline where people 24/7 can call. If they have been abused, they have a case they want to report, dealing with what we're talking about right now. That's how important it is. Let's shift gears.
And it's ringing off the hook, by the way.
I know. Apparently, they can't even handle the number of calls. Excuse me, Senator. I talked offline with you about an initiative we have called Right from the Start, NJ. Our team will put up the website right now. Looking to protect, take care of, deal with the needs of infants and toddlers, 0 to 3. We had State Senator Teresa Ruiz here, your colleague, talking about legislation you're involved in. Had the Commissioner of Health, Commissioner of Family Services, I'm not sure the exact title of the department, but a whole range of other government officials dealing with this population. What is the primary focus and concern you have as it relates to dealing with those who are 0 to 3 and prenatal care connected to that as well for moms who give birth?
Sure. Well, we know that there are a number of issues involved in that this particular topic. All parents know, and most experts will tell you, that a child's development between the ages of 0 and 3 is paramount to their development over time. If we don't get them earlier, sooner, then they fall behind. They fall behind those children who have access to take care of child care and good teachers. So we're hoping that over time, particularly children and families who don't have the means and the wherewithal to afford child care. We just had a child 9 months ago. It's expensive. To expect a middle class or a low-income family. Yeah, to low-income family. Thank you. Low-income family.
You told me you're not
I'm sleeping a little
much.
better. A little better. Mom's taking the beating, not me.
Got it.
But if we don't catch them early enough, then it's tragic for them because they fall behind.
What about child care workers? Senator Ruiz talked about this. What are we paying child care workers? Is it enough? How does this impact who we're recruiting and retaining into this critically important field, protecting infants and toddlers?
Well, it's just like we talk about home care workers, people who come into the homes or folks who work in nursing homes, people who have the toughest jobs, people who are taking care of children. Many times it's 3 or 4 at a time, right? That's the limit, that's the ratio. It's difficult work and it's important work. And if we don't pay them a living wage with benefits, how are we going to recruit and retain people? Anyone who's watching this knows that you have a job, even if it's, you wake up sometimes you're not happy about going to work, but you're making a good living, you're providing for your family. If you can't do that as a child care worker, you're going to go someplace else.
Educating the public about prenatal care. And again, we'll put up our website again. Why is that so important?
Well, prenatal care is important for the mom and for the kid. So we, St. Barnabas, Robert Wood Barnabas and the Barnabas Health System have done a great job at a new initiative to really ramp up what's called Stop, Look, and Listen, to talk to the mom just after they've given birth and before to make sure that she's okay. And there are signs that they need to sort of acknowledge if she's in trouble or maybe in trouble going forward. But prenatal care is paramount in New Jersey, especially in urban communities where healthcare access is limited through Medicaid providers. Those moms don't get the prenatal care they need, and the kids suffer for it.
We're talking to State Senator Joseph Vitale, the leader of in the state legislature when it comes to a whole range of healthcare issues. Steve Adubato here. This is State of Affairs. The Trump administration and their efforts as it relates to, I'm not going to say dismantling, but changing the Affordable Care Act, otherwise known as Obamacare. What does that mean in New Jersey, A and B? What are you and your colleagues doing to protect New Jerseyans and their health coverage?
Well, Donald Trump and the Republicans in Washington, as you said, made it a mission when
Congress,
right, to dismantle the ACA. And they've been doing a pretty good job of it lately, but New Jersey has stopped them. So Governor Murphy signed my legislation just a couple of months ago that requires individuals in New Jersey to have health insurance. The Republicans in Congress and the president are doing away with that at the end of the year, and that's very important to know that.
Is that the individual mandate?
The individual mandate. So you have to have insurance. And we also passed the bill the governor signed that will lower insurance rates in the individual market by nearly 9% next year. It's a new reinsurance model. It's adopted by states across the country, Republican and Democrat governors. Scott Walker in Washington, in Wisconsin, Republican, Democrats in New Jersey and in Oregon and other places have adopted this new measure. Lower insurance rates, that's never happened in the history of health insurance. So that'll go down next year for those individuals. And so we've done what we can to push back against Washington, push back against what Trump and the Republicans in Congress have said is just an awful health care system. And they've never suggested replacing it with anything better.
By the way, what happens if the Affordable Care Act, the ACA, Obamacare were done away with, repealed totally? What do you think would happen?
Well, it would be a disaster for millions of Americans and for hundreds of thousands, if not millions of New Jerseyans, because they will be left without insurance. And those who are left with insurance, whether through business or otherwise, will pay more because people who are sick will go to the hospital. Those rates will skyrocket, and those costs are pushed onto health insurance plans that the rest of you and I have.
But Senator, before I let you go, there are some aspects of the Affordable Care Act that you and many others have acknowledged, hey, wait, it's not right. It's not working the way it should.
Well, look, I think that if the subsidies that we provide for low-income families was greater, because you have a bubble, right? If you earn a certain amount of money, you get a subsidy. Just over that, you don't. I'd love to see the federal government be able to say, look, we're going to raise that cap, but they won't do that because they want it to fail. If we did it in New Jersey,
They want it to fail?
of course they do. They've said that they want it to fail. They want to dismantle Obamacare, the Affordable Care Act.
By it failing and then saying, you see, we were right?
Well, making sense of what they're saying has never made sense.
This is State Senator Joseph Vitale. Joe, I want to thank you for your service in the state, the role you're playing in the Senate Health, Human Services, and Senior Citizens Committee, and also the Vice Chair of the Senate Labor Committee, and also, more importantly, being a dad, new dad.
It's great
How many
stuff.
months again?
9.5. Best thing I ever did.
Thank you, Joe.
Thank you,
Appreciate it.
Steve.
Stay right
My
there.
pleasure.
State of Affairs, Steve Adubato. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by the New Jersey Education Association, the Turrell Fund, supporting Right from the Start NJ, the Northward Center, New Jersey Sharing Network, Summit Medical Group, Delta Dental of New Jersey, and by Keystone Mountain Lakes Regional Council of Carpenters. Your future is in our building.